Some breaking news right now. The CDC's outside advisory panel has decided to table a vote on what's next for the Johnson & Johnson one-dose coronavirus vaccine. This means that it will continue to be paused. Advisors say they need more information on the rare blood clots before making a decision. NBC News medical contributor and primary care physician Dr. Kavita Patel joining me now. Dr. Patel, what can you say about this new information that we're just getting in about this decision?
Yeah, Jennifer, very briefly, the CDC Advisory Committee did feel like they needed not just more data, but they really wanted to see how the next several weeks play out. Remember, people up until yesterday have been receiving the Johnson & Johnson vaccine. They want to look to see if there are more events, to see if there are additional patterns so that they don't make a quick decision to limit this in any way without looking at the full picture. I do worry, though, that every day that goes along could promote some unintended consequences or some hesitancy about vaccines in general.
Dr. Patel, has causation been established? Do we know that the vaccine is causing these potentially dangerous clots? Like, what are scientists thinking about what's going on here?
Yeah, great question. Briefly, no, we do not have a causal link, but we do see a strong association with a very rare blood clot. And that is also something we're seeing with the AstraZeneca vaccine, even though we don't use it in the United States. It's a similar type of vaccine with unfortunately similar clots that have resulted in some deaths in higher numbers in other countries. So it is something where we're looking for the links, but no cause yet. And it could be linked to the type of vaccines themselves, the technology we use to give people the vaccine, as well as the antigen, the actual spike protein that we try to fool our bodies into believing is the coronavirus. That could play some part along with our own immune systems. Again, very rare. Reassure the public if you've gotten Johnson & Johnson recently, see your doctor if there's something unusual, but 99.99% of people will have none of these events.
You talked about reassurance there, and you mentioned vaccine hesitancy. That's already out there, and more people have been getting the vaccine after watching others do it, but now this news comes out. So what do you say to others who are now saying, maybe I should step back and look at this again?
Yeah, here's what I say. We don't have the luxury of time to step back, and we have a blessing in the United States. We have amazing science, and we're lucky. We have two other manufacturers and an unbelievable supply to be able to say confidently that without Johnson & Johnson, we can still vaccinate the entire country, all of Atlanta, all of Georgia. So do not hesitate. It does save lives. We're watching people die, 5,000 deaths in 7 days that we can avoid by getting your shot and rolling up your sleeves.
A good reminder. Dr. Patel, thank you so much. I know we'll hear much more from you on this tonight on Nightly News at 6:30. Thank you.